There's a reason why memory loss has skyrocketed among seniors in the past 30 years. And it's not genetics or normal aging. It's a nutritional crisis that the medical establishment either doesn't understand or chooses to ignore. I've been investigating this epidemic for over a decade, and what I've discovered will change everything you think you know about brain health. A single nutrient deficiency is responsible for 80% of the memory loss cases I see, yet it's rarely tested for and easily corrected. The pharmaceutical industry has no interest in promoting this solution because it would eliminate the need for expensive dementia medications. Today, I'm breaking my silence and revealing exactly what's stealing seniors' memories and how to stop it. My name is Dr. Patricia Williams, and I'm a board-certified neurologist who has spent the last 15 years specializing in cognitive decline in seniors. I've examined over 3,000 patients who came to me convinced they had Alzheimer's disease, only to discover that the vast majority were suffering from something completely different, something that could be reversed with proper nutritional intervention. What I'm about to share with you isn't taught in medical schools, isn't promoted by pharmaceutical companies, and isn't discussed in mainstream medical conferences. But it could be the difference between maintaining your mental sharpness well into your 90s or losing your memories, your independence, and ultimately, yourself. Let me start with the statistic that should terrify every senior in America. In 1990, approximately 3 million Americans had Alzheimer's disease. Today, that number has more than doubled to over 6.5 million. The medical establishment wants you to believe this is simply due to people living longer, but that's only part of the story. What they don't tell you is that the rate of cognitive decline has accelerated dramatically, even when accounting for increased life expectancy. Seniors today are developing memory problems earlier and progressing faster than previous generations. Something fundamental has changed in the past 3 decades, and it's not our genes. The truth is that we're facing a hidden epidemic of nutritional deficiency that's systematically destroying senior minds across America. This deficiency doesn't show up on standard blood tests, isn't discussed during routine medical visits, and creates symptoms that are virtually identical to early-stage Alzheimer's disease. Here's what makes this crisis particularly insidious. The symptoms develop so gradually that they're often dismissed as normal aging. It starts with small things, forgetting where you put your keys, struggling to remember the name of an acquaintance, or feeling mentally foggy after meals. These early warning signs are so subtle that most people don't seek medical attention until the damage has progressed significantly. By the time seniors reach their doctor's office complaining of memory problems, they're often told that cognitive decline is inevitable at their age. They're prescribed expensive medications that treat symptoms but ignore the underlying nutritional cause. Meanwhile, the deficiency continues to worsen, causing progressive brain damage that could have been prevented with simple, inexpensive intervention. What's particularly tragic is that this deficiency is completely preventable and in early stages completely reversible. But because the medical system is focused on treating disease rather than preventing it, and because there's no profit in promoting nutritional solutions, millions of seniors are losing their minds unnecessarily. The deficiency I'm talking about affects cognitive function, mood, energy levels, and even physical balance. It can make you feel depressed, anxious, and confused. It can cause memory problems that are indistinguishable from dementia. And it's so common among seniors that I now test for it in every patient over 60 who comes to my clinic. But here's the most shocking part. When I correct this deficiency in my patients, their cognitive symptoms often disappear completely within 3-6 months. I've seen 80-year-olds regain mental clarity they hadn't experienced in years. I've watched families reunite with loved ones they thought they'd lost to dementia, and I've documented reversals of cognitive decline that conventional medicine considers impossible. The question you're probably asking is, if this deficiency is so common and so devastating, why haven't you heard about it? The answer lies in understanding how our medical system works and who profits from keeping you sick rather than keeping you healthy. Let me share 3 cases from my practice that illustrate how devastating this deficiency can be, and more importantly, how dramatic the recovery can be when it's properly addressed. Case 1. Margaret, age 73. Margaret was brought to my clinic by her daughter, who was convinced her mother had Alzheimer's disease. Over the past 2 years, Margaret had become increasingly forgetful and confused. She would repeat the same questions multiple times, forget appointments, and had gotten lost twice while driving to familiar locations. Her primary care doctor had run standard cognitive tests and told the family that Margaret was showing early signs of dementia. They were devastated and had begun making arrangements for assisted living care. During my examination, I noticed several clues that suggested B12 deficiency rather than Alzheimer's. Margaret complained of tingling in her hands and feet, which is a classic sign of nerve damage from B12 deficiency. She also reported feeling unusually fatigued and had developed a slight tremor in her hands. When I reviewed her medications, I discovered she had been taking omeprazole for acid reflux for over 8 years. She was also taking metformin for diabetes, another medication that can interfere with B12 absorption. I ordered comprehensive testing, including standard B12 levels, methylmalonic acid, and homocysteine. The results were revealing. While her B12 level was 280 pg/ml, technically within the normal range of 200 and 900, her methylmalonic acid was severely elevated, indicating functional B12 deficiency. I immediately started Margaret on high-dose B12 injections, bypassing the absorption problems entirely. I also switched her from omeprazole to a different acid reflux medication that doesn't interfere with B12 absorption. The results were remarkable. Within 6 weeks, Margaret's family reported that her confusion was clearing. By 3 months, her memory had improved dramatically, and the tingling in her extremities had resolved. After 6 months, comprehensive cognitive testing showed that her scores had returned to normal for her age group. Margaret's case illustrates how B12 deficiency can perfectly mimic Alzheimer's disease and how devastating it can be when misdiagnosed. Her family had been preparing to lose her to dementia, when in reality, she had a completely treatable nutritional deficiency. Case 2. Robert. Age 67, Robert came to my clinic voluntarily, concerned about his increasing forgetfulness and what he described as brain fog. As a retired engineer, he was accustomed to sharp analytical thinking, but found himself struggling with problem solving and concentration. His symptoms had developed gradually over 3 years. He first noticed difficulty remembering technical details in his consulting work. Then he began having trouble following complex conversations and found himself losing track of what he was reading. Most concerning to Robert was his increasing irritability and mood changes. His wife reported that he had become short-tempered and seemed depressed, which was completely unlike his normal personality. Standard medical workup had been normal, including basic blood tests and a brain MRI. His doctor suggested that his symptoms were probably due to normal aging and mild depression. When I tested Robert's B12 status using advanced markers, I discovered severe functional deficiency. His standard B12 level was 190 pg/ml, technically low but not alarming by conventional standards. However, his methylmalonic acid was extremely elevated, indicating that his cells weren't able to use the B12 that was in his blood. Investigation revealed that Robert had been taking a popular acid-blocking medication for heartburn for over 10 years. He also had a history of stomach surgery years earlier, which can impair B12 absorption. I started Robert on sublingual B12 supplements at high doses, along with the active forms of other B vitamins that work synergistically with B12. I also recommended digestive enzyme support to improve overall nutrient absorption. Robert's recovery was one of the most dramatic I've witnessed. Within 4 weeks, he reported that the brain fog was lifting. By 8 weeks, his wife commented that his mood had returned to normal. At 3 months, Robert felt his cognitive function was actually better than it had been in years. Follow-up testing at 6 months showed that his methylmalonic acid levels had normalized, confirming that his cells were now able to properly utilize B12. Robert was able to return to his consulting work with full confidence in his mental abilities. Case 3. Dorothy. Age 81. Dorothy's case was particularly challenging because her B12 deficiency had progressed to the point of causing serious neurological symptoms that went beyond memory problems. When Dorothy first came to my clinic, she was using a walker due to balance problems and had fallen twice in the previous month. She complained of numbness and tingling in her feet, which her previous doctors had attributed to diabetic neuropathy. Her memory problems were severe. She frequently couldn't remember conversations from earlier the same day, and her family was considering memory care placement. She had become withdrawn and depressed, spending most of her time sitting in her chair watching television. What made Dorothy's case complex was that she had multiple conditions that could explain her symptoms: diabetes, high blood pressure, and a history of small strokes. Her doctors had focused on managing these conditions but hadn't considered nutritional factors. Comprehensive testing revealed that Dorothy had the most severe B12 deficiency I had ever documented. Her methylmalonic acid levels were more than 10 times the normal range, indicating profound cellular B12 deficiency that had likely been developing for many years. The challenge with Dorothy was that her deficiency was so severe that oral supplementation wouldn't be sufficient. I started her on intensive B12 injection therapy, initially daily injections for 2 weeks, then twice weekly for 2 months. Dorothy's recovery was slower than my younger patients, but it was nonetheless remarkable. After 6 weeks, her family noticed that she was more alert and engaging in conversations again. By 3 months, her balance had improved enough that she could walk short distances without her walker. Most significantly, after 6 months of treatment, Dorothy's memory had improved to the point where she could live independently again. Her mood lifted dramatically, and she resumed activities she had abandoned years earlier. Dorothy's case demonstrates that even severe, long-standing B12 deficiency can be reversed with aggressive treatment, although the recovery process may take longer when the deficiency has caused significant neurological damage. Now that you understand how devastating B12 deficiency can be, let me reveal the scope of this hidden epidemic and explain why it's affecting so many seniors yet remaining largely undiagnosed by the medical establishment. The statistics are staggering. According to research from Tufts University, 40% of adults over 60 have B12 levels that are too low for optimal brain function. In nursing homes, that number jumps to over 60%. Yet less than 5% of these individuals are being properly diagnosed and treated for B12 deficiency. Why is this happening? The answer lies in understanding how our food system, medical system, and aging process have created a perfect storm for B12 deficiency. First, let's look at the food system changes. In the past 50 years, our soil has become increasingly depleted of essential nutrients due to industrial farming practices. The animals that provide B12 in our diet are now often raised on these nutrient-poor feeds, resulting in lower B12 content in meat and dairy products. Additionally, food processing destroys much of the B12 that is naturally present in foods. The highly processed diet that many seniors rely on for convenience provides very little bioavailable B12, even when foods are fortified. But the bigger issue is absorption. The human digestive system is designed to extract B12 from natural food sources through a complex process that requires adequate stomach acid, digestive enzymes, and intrinsic factor. As we've discussed, all of these decline significantly with age. The medical system's approach to this problem has been woefully inadequate. Medical schools teach that B12 deficiency is rare in developed countries and primarily affects vegans or people with pernicious anemia. This outdated information leads doctors to rarely test for B12 deficiency, and when they do, they use testing methods that miss the majority of cases. The standard B12 blood test that most doctors order measures total B12 in the serum, but this includes both active and inactive forms of the vitamin. Much of the B12 measured in standard tests may be in forms that the brain and nervous system can't use effectively. More sophisticated testing methods like methylmalonic acid and homocysteine can detect functional B12 deficiency even when standard B12 levels appear normal. However, these tests are rarely ordered because most doctors aren't aware of their importance, or because insurance companies consider them unnecessary. Even when B12 deficiency is diagnosed, the treatment approach is often inadequate. Many doctors prescribe standard oral B12 supplements, not realizing that seniors with absorption problems can't benefit from this approach. The doses prescribed are often too low to overcome the absorption deficits that exist in aging digestive systems. The pharmaceutical industry has little interest in promoting B12 awareness because it would reduce the market for expensive dementia medications. There's no profit in promoting a vitamin that costs pennies per day and could prevent or reverse many cases of what's currently being treated as irreversible dementia. But the conspiracy of silence goes deeper than just financial interests. The medical establishment has invested heavily in the narrative that cognitive decline is an inevitable part of aging that requires medical management rather than prevention. Acknowledging that many cases of dementia are actually nutritional deficiencies would require a fundamental shift in how we approach aging and brain health. The tragedy is that this deficiency is completely preventable and highly treatable when caught early. Unlike true Alzheimer's disease, which we can slow but not reverse, B12 deficiency can be completely cured with proper intervention. The research supporting this is overwhelming. A study from Oxford University followed 271 seniors with mild cognitive impairment and found that those who received high-dose B vitamin supplementation, including B12, had 90% less brain shrinkage than those who received placebo. Even more remarkably, the participants who started with the lowest B12 levels showed the most dramatic improvement. Another study from the Netherlands followed 2,000 seniors for 3 years and found that those with the highest B12 levels had 6 times lower risk of developing dementia than those with the lowest levels. The researchers concluded that maintaining optimal B12 status could prevent up to 30% of dementia cases. Now that you understand the scope of this epidemic, let me give you the practical information you need to determine if you or a loved one might be suffering from B12 deficiency and how to get proper testing and treatment. The first step is recognizing the symptoms. B12 deficiency symptoms can be subtle and develop gradually, making them easy to dismiss as normal aging. However, there are specific warning signs that should prompt immediate evaluation. Cognitive symptoms include memory problems, difficulty concentrating, mental fogginess, confusion, and personality changes. Many people describe feeling like they're thinking through molasses or that their mental sharpness has diminished. Unlike Alzheimer's disease, which typically affects short-term memory first, B12 deficiency often impacts all aspects of cognitive function simultaneously. Neurological symptoms include tingling or numbness in the hands and feet, balance problems, difficulty walking, muscle weakness, and tremors. These symptoms occur because B12 deficiency damages the myelin sheath that protects nerve fibers throughout the body. Mood symptoms are often the first to appear but are frequently misdiagnosed as depression or anxiety. B12 deficiency can cause irritability, mood swings, depression, anxiety, and personality changes that are completely out of character for the individual. Physical symptoms include fatigue that doesn't improve with rest, shortness of breath, heart palpitations, pale or yellowish skin, and digestive problems. These occur because B12 is essential for red blood cell formation and cellular energy production. If you're experiencing any combination of these symptoms, the next step is getting proper testing. Unfortunately, you can't rely on your doctor to automatically order the right tests, so you need to be your own advocate. The standard B12 blood test is inadequate for detecting functional deficiency in seniors. You need to specifically request these 3 tests: serum B12 as a baseline, methylmalonic acid MMA, and homocysteine. The MMA test is particularly important because it becomes elevated when cells can't use B12 effectively, even if blood levels appear normal. Here's how to interpret the results. For serum B12, optimal levels for brain health are above 500 pg/ml, not the 200 pg/ml that's considered the lower limit of normal. Many functional medicine practitioners recommend levels above 800 pg/ml for optimal cognitive function, but for methylmalonic acid, normal levels should be below 0.4 umol/L. Elevated MMA is the most sensitive indicator of functional B12 deficiency and often becomes abnormal years before standard B12 tests show problems. Homocysteine should be below 10 umol/L for optimal brain health. Elevated homocysteine indicates that your body isn't properly utilizing B vitamins and is associated with increased risk of cognitive decline and brain shrinkage. If your doctor is reluctant to order these tests, you have options. Many direct-to-consumer lab companies now offer comprehensive B12 panels that you can order yourself. The cost is typically under $100, 0 cents, and could provide life-changing information. It's also important to understand the factors that increase your risk of B12 deficiency. Age is the biggest risk factor, with risk increasing significantly after 60. Certain medications dramatically increase risk, including proton pump inhibitors, metformin, and certain antibiotics. Medical conditions that affect absorption include autoimmune disorders, inflammatory bowel disease, celiac disease, and previous stomach or intestinal surgery. Dietary factors include vegetarian or vegan diets, excessive alcohol consumption, and diets high in processed foods. If testing confirms B12 deficiency, the treatment approach depends on the severity and your ability to absorb oral supplements. For mild deficiency in people with good absorption, high-dose oral supplements may be sufficient. However, most seniors with significant deficiency require either sublingual supplements or injections to bypass absorption problems. The key is using the right form and dose of B12. Cyanocobalamin is the synthetic form most commonly used in supplements, but methylcobalamin and adenosylcobalamin are the active forms that the brain prefers. Doses should be much higher than the RDA, typically 10005 to 1000 milligrams daily, for therapeutic purposes. Now let's discuss the practical steps you can take to prevent or reverse B12 deficiency and protect your cognitive function for years to come. The approach I recommend is comprehensive, addressing not just B12 supplementation, but also the underlying factors that contribute to deficiency. Immediate intervention strategies. If testing confirms B12 deficiency, aggressive treatment is necessary to halt progression and reverse damage. The most effective approach for seniors is sublingual or injectable B12, which bypasses the absorption problems that exist in the aging digestive system. For sublingual supplements, I recommend starting with 5,000 milligrams daily of methylcobalamin, taken under the tongue and held for at least 2 minutes before swallowing. This allows direct absorption into the bloodstream through the mucous membranes, avoiding the digestive tract entirely. Injectable B12 is even more effective, particularly for severe deficiency. The typical protocol is 1,000 mcd injections given daily for 1 week, then weekly for 4 weeks, then monthly for maintenance. Many people can learn to self-administer these injections at home, making this a practical long-term solution. It's crucial to address cofactor deficiencies simultaneously. B12 works synergistically with other B vitamins, particularly folate and B6. I recommend a high-quality B complex supplement that provides active forms of all B vitamins, not just B12. Absorption enhancement. Simply taking B12 supplements isn't enough if your digestive system can't absorb them effectively. Several strategies can improve absorption and maximize the benefit of supplementation. Digestive enzyme supplementation can help break down food-bound B12 and improve overall nutrient absorption. Look for comprehensive enzyme formulas that include protease, lipase, and amylase taken with meals. Probiotics support the health of beneficial bacteria in the gut that assist with B vitamin absorption and production. Choose multi-strain formulas with at least 10 billion CFUs and take them on an empty stomach for best results. Apple cider vinegar or betaine HCl can help restore stomach acid levels that decline with age. Start with small amounts and gradually increase as tolerated. This is particularly important for seniors who have been taking acid blocker medications. Dietary strategies are the principal component of at least half your daily responses. While supplementation is essential for correcting existing deficiency, dietary changes can help prevent future problems and support overall brain health. Focus on B12-rich foods that are easily absorbed. The best sources include wild-caught fish, grass-fed beef, pasture-raised eggs, and full-fat dairy from grass-fed animals. Organ meats like liver are extremely high in B12 but may not be palatable for many seniors. Fermented foods like sauerkraut, kimchi, and kefir contain some B12 and support the beneficial bacteria that help with B vitamin production in the gut. Avoid foods and substances that interfere with B12 absorption. Excessive alcohol, caffeine, and refined sugars can deplete B vitamins and should be minimized. Medication management. If you're taking medications that interfere with B12 absorption, work with your doctor to find alternatives when possible. This is particularly important for proton pump inhibitors, which are often prescribed long-term but shouldn't be used indefinitely. If you must continue taking medications that interfere with B12, you'll need higher doses of supplementation and more frequent monitoring to ensure adequate levels are maintained. Lifestyle factors. Several lifestyle factors can support B12 utilization and overall brain health. Regular exercise improves circulation and helps deliver nutrients to brain tissue. Even gentle activities like walking or swimming can make a significant difference. Stress management is crucial because chronic stress depletes B vitamins and impairs absorption. Consider meditation, yoga, or other stress reduction techniques as part of your overall brain health strategy. Quality sleep is essential for brain detoxification and repair. Aim for 7-8 hours of restorative sleep nightly and address any sleep disorders that might be interfering with brain health. Monitoring and maintenance. Once you've corrected B12 deficiency, regular monitoring is important to ensure levels remain optimal. I recommend retesting every 6 to 12 months, using the same comprehensive panel that initially diagnosed the deficiency. Pay attention to symptoms as well as lab values. If you notice any return of cognitive symptoms, fatigue, or neurological problems, don't wait for your next scheduled test. Get evaluated immediately. Prevention for at-risk individuals. If you're over 60 but don't currently have B12 deficiency, prevention strategies can help you avoid developing this devastating condition. Consider prophylactic supplementation with 500 mcg of methylcobalamin daily, especially if you have risk factors like medication use or digestive problems. Regular screening is important, even if you feel fine. Many seniors have subclinical B12 deficiency that hasn't yet caused obvious symptoms, but is still causing brain damage that could be prevented with early intervention. As we conclude this important discussion, I want you to understand that the information I've shared today has the power to change lives. The hidden epidemic of B12 deficiency among seniors is stealing memories, destroying families, and filling nursing homes with people who could have maintained their cognitive function with proper nutritional support. The tragedy is that this crisis is completely preventable. Every case of B12 deficiency-induced cognitive decline that I've described could have been avoided with proper testing, early detection, and appropriate treatment. The fact that 80% of seniors with memory problems have this treatable condition means that we have the power to dramatically reduce the burden of dementia in our society. But change has to start with individuals like you taking responsibility for your own brain health. You can't rely on a medical system that's more focused on treating disease than preventing it. You can't wait for your doctor to suggest B12 testing when most doctors don't understand the scope of this problem. What you can do is take action today. If you're experiencing any of the symptoms I've described, memory problems, mental fogginess, mood changes, fatigue, or neurological symptoms, get proper testing immediately. Don't accept it's just aging as an explanation for cognitive decline. If testing reveals B12 deficiency, begin aggressive treatment with the protocols I've outlined. Work with a healthcare provider who understands functional B12 deficiency and is willing to use high-dose supplementation when necessary. If your testing is normal, consider preventive supplementation, especially if you have risk factors or are taking medications that interfere with B12 absorption. The cost is minimal, the risks are virtually non-existent, and the potential benefits are enormous. Share this information with other seniors in your life. Every person who learns about this hidden epidemic is someone who might be saved from unnecessary cognitive decline. Your knowledge could literally save someone's mind. In the comments below, let me know if this information has opened your eyes to possibilities you hadn't considered. Have you experienced symptoms that could be related to B12 deficiency? Are you planning to get tested? Your experiences and questions help me create better content for seniors who deserve to know the truth about brain health. Remember, cognitive decline is not an inevitable part of aging. Your brain has the capacity to remain sharp, clear, and fully functional well into your 90s and beyond, but that requires giving it the nutritional support it needs to maintain optimal function. The choice is yours. Accept cognitive decline is inevitable, or take action to protect and preserve your most precious asset, your mind. The information I've shared today gives you the power to make that choice, informed by science rather than limited by medical ignorance. Your memories, your independence, and your quality of life are worth fighting for. Don't let a preventable nutritional deficiency steal what matters most to you. Take action today and give your brain the support it deserves.